The demand for COVID-19 testing continues to reach new highs, and the Biden administration is now preparing to send free at-home tests to families nationwide. It begs the question, how effective are those at-home tests? News 8's Nina Burns spoke to local health officials who tell us how much truth is behind those take-home tests. It's part of our COVID-19 coverage on News 8.
Long lines,
testing all across the country is at or beyond capacity.
and short supplies, as limited COVID-19 testing options turn more people towards at-home testing.
Well, if you can get them.
Scott County Health Department's medical director, Dr. Lewis Katz, says at-home tests have the potential to work, depending on the situation.
The molecular test, the PCR that everybody's heard about, detects the genetic material after many rounds of amplification.
Meaning antigen or at-home tests aren't as sensitive, which may be beneficial when finding out risk.
If you have COVID, your PCR test can stay positive for weeks past when you're infectious. I think that these rapid home tests, the antigen tests, are actually probably better at giving us an idea whether you're infectious or not.
And a disadvantage when it comes to accuracy.
CDC has said that the home-based test may not be as reliable with the Omicron variant.
You need to know when to trust a negative result. I pretty much trust a positive result. A negative result is much more problematic using a less sensitive test.
Dr. Katz recommending that any negative result be followed by another test 24 to 48 hours later. And when it comes to using at-home tests to return to work,
It's really a toughie.
that's up to the employer.
My default position is have a trained individual get the specimen. But in low-risk situations, self-sampling and testing, I think, can be made acceptable.
Nina Burns, WQAD News 8.
The CDC strongly suggests employers move away from a test-based strategy, switch instead to a 5-day isolation period before allowing employees to return to work.